How you doing? My name is Ira, and today I'm here to share a bit of my story about living with phantom pain and how I come to live without phantom pain. But first, let me share with you how I was introduced to phantom pain. Some 5 months ago, I was in a real bad motorcycle accident, and in the course of things, I lost a limb. I lost my left leg, the lower extremity. Um, I had a whole lot of other injuries. However, that was the most traumatic, and it was hard to deal with. However, you know, what happens happens, and we have to keep moving. Um, Upon losing my leg in the hospital, I was, like I said, it was below the knee that my leg was severed on the scene. But while the doctors, they tried to saber what was left of the lower leg, and a few days later, they found that I guess it would be best that they go above the knee because they could not salvage what was left below the knee. So I became very quickly an above the knee amputee. With this new experience, the doctors would come in every day to take a look at it, and in doing so, when they unwrap the bandages to check it out, it's as if every nerve in my leg was just grabbing onto every atom in existence, causing excruciating pain. And although I was on medication in the hospital at the time, it just seemed not to be doing any justice. So they went on and cut above the knee, and after that, I was still in the hospital. I was in the hospital for a total of 34 days. Pretty medicated. But even in the hospital, I had to see a pain specialist because the pain just was still unbearable, and they had to try to find a proper level of medication to accommodate me. However, after being sent home, it seemed I was on less medication and more pain. This, I soon learned to be what they call phantom pain. Phantom pain is very real, disturbing. I had many sleepless nights. Entered another pain clinic to which, to no avail, I still suffered the same symptoms of this phantom pain. It was relentless. I would stay up rocking all night, 1 o'clock in the morning to 5 o'clock in the morning, changing positions, nothing would work. And I had home health nurses coming to the home, helping me out with wound care, other wounds. And I would express to them about this pain that I was having constantly. So it wasn't until this one particular home health nurse, she made mention that she knew of another amputee who had the same issues. However, that other patient had something done, a surgery or whatever, but to where she no longer experiences this type of pain. So I was like, well, that would have been nice for the doctors to have done to me before we got to this point. However, that wasn't the case, and I really didn't know the process of it to the extent that I do now. And just by happenstance, I happened to have an appointment with my orthopedic doctor. Having gone through all this pain, I expressed to him, I said, Doc, is there anything that you can do about this pain? I heard about this surgery called TMR, and it's as if as soon as I said that to him, he looked at me just like, he said, hold on. I'm telling you, he walked right up the hall, came right back within about 4 minutes with another doctor. And this doctor happened to be Dr. Wimalawansa. And they looked it over, asked me a lot of questions, looked at my limb. And before we knew it, I was going back into surgery to try to get this phantom pain corrected. Once I met with Dr. Wimalawansa, they got me in surgery because I had 2 surgeries that they did at the same time. So now I felt totally debilitated once I came out of that surgery because I couldn't use any one of my legs. It was almost worse than the first. At least I had one good one the first time. However, after this surgery was conducted by Dr. Wimalawansa and his partner, I didn't feel any pain. I would get a pain here, a sensation there, but few far and in between. Nothing like I initially was experiencing. Dr. Wimalawansa would always tell me, like, well, don't get too excited. Give it about 3 months, 2 to 3 months, so we can get a true assessment of what's going on. So I was like, okay, well, I think it's gone. You know, because I want anything to be away from that pain that I was experiencing, because it was just that bad. You know, so we went through the process, had the surgery. It was very successful, very successful. It's to the point now, and this is only 5 months removed from my actual accident. I'm back working full time, driving, getting around with no problem. I will have my prosthetic next week, you know, so I had an opportunity to be on that, and the care that I've been receiving, you know, from Dr. Wimalawansa and his staff has been phenomenal. You know, it's very personal, and I recommend a doctor like this to everyone, you know, and I really am thankful and grateful to be given the support that I've been given from my family relationship, my work relationship, my peers, and my doctor care. And if you guys have any questions, you know, I'll be willing to answer if you have any. Other than that, you know, it's been a ride, and I've been loving it, you know.
A couple questions.
Yes, sir.
How would you rate your pain, like, before surgery, and how much meds were you on?
My pain before surgery, it was 1 to 10. It stayed at 10. It stayed at 10, and I was on so much medication that it was a problem keeping up with it. So I had gotten to the point to where I got so frustrated, I would just stop taking it sometime, you know, because I didn't want it tearing up my body internally. You know, first of all, I didn't want to get hooked on any type of, what do they call it? Narcotic medication that was prescribed to me. So and at one point I tried to take it in my own hands by stop taking the oxycodone that they were prescribing to me, and I shouldn't have done that soon, because I went into withdrawal, and I couldn't understand why. But I put myself back on it, which was a smart thing to do. But now, since the surgery, my pain level is non-existent. It's non-existent. So
Are you taking any of your medicine anymore?
I'm not taking any medication today. I'm not taking any medication at all. You know, I still have prescriptions and stuff like that, but I don't take any of that medication. I haven't for over a month. You know.
Is there anything you wish you knew before surgery that you know now, going into this?
Is there anything that I wish I would have known before surgery? Before the
That TMR.
TMR surgery?
Mm-hmm.
No, actually, it worked so well for me. I have, you know, I was in it. You know, I was willing to do anything to help get this pain away. So it was really not about me having questions or even wondering. It was just that pain was that bad that I would try anything. You know, so my mind didn't go there to, like, what should I do? No, I just need this pain gone. You know, so that's exactly what happened. You know, a positive attitude, positive mindset. I've always been an optimistic person prior to my situation, and just it is what it is. You know, I'm very spiritually strong, and if I'm to believe that all was created by one, then I can't question it. Anything that happens in life, I have to deal with it, and I do. You know, so.